Right, so I'm going to talk about the precision medicine centers for sure, but more about a new initiative that has been formed earlier this year by 7 of the regions, so the university hospital regions. So my name is Helena Nilsson. I come from region Örebro County. I have a PhD. I'm an analytical chemist, but I'm not doing any of that anymore. And I am leading the national initiative, which is called Roadmap to Implementation of Precision Medicine in Swedish Healthcare. So this is a joint initiative by the 7 university hospital regions in Sweden. And you've already received this information about the healthcare is structured in Sweden. We have 21 regions, 7 of them are university hospital regions, and those are the 7, and this is where they are located. And the healthcare directors of those 7 regions came together earlier this year and said, right, let's agree that we have the ambition of providing what you have just heard about, all the bottom-up initiatives, right? We need a top-down. So the healthcare director said that we have to work towards facilitating the implementation in routine standard care to the benefit of the patient. So so this roadmap or the strategy that is now being formed, that is really unique because for this strategy, the healthcare is the sender, not the recipient of this strategy, and that is an important factor. So I already mentioned that they came together during the spring of 2024, and this initiative is now ongoing. It started in August. I am leading this initiative, and we will have the main delivery of our final product, which will be the roadmap with action points by the end of next year. So it's fast, it's demanding, but we are working really well together in the network of Sweden. And really, Sweden is like, I don't know what, suburb to Mumbai, you know. So really, we should be able to work together really well, and which we are doing. Right, so why are they doing this? Well, we've heard about all those bottom-up initiatives. It's fantastic what they are doing at GMS. We have the advanced therapies, and we are at the ATMP. We have lots of experience, which you have heard Anna telling us about from within healthcare, and all those different initiatives. But we really need the big decisions. We need the policymakers to put the way forward and to also make the right investments so that we can have a sustainable healthcare to the benefit of the patient. So that is what we are doing in this initiative. All right, so the steering committee of the initiative, I mentioned the 7 healthcare directors, and these are the ones who is the steering committee of this, and they are really involved in this. We have meetings every month, and during the spring, they will be participating in workshops every month. So it's not like they are sitting far from the initiative, they are in the initiative. So in this context, for this initiative, we are really talking about precision medicine, which you have heard mentioning from all the previous speakers. This is a really broad perspective. We are including diagnostics, prevention, treatment, follow-up, and everything should be integrated with clinical research, innovation, and development. So this is really the systems change that we've heard about previous speakers talk about. And implementation of precision medicine into routine healthcare, because it has to be implemented in routine healthcare. We are really talking about the process of introducing this and facilitating the staff, the personnel, the healthcare professionals. This is a new way of working. It's a cultural shift as much as a technological shift, right? And it has to be sustainable. It has to work for the future of healthcare. We have a huge demographic challenge. We know that we have an elderly population and less people wanting to work in healthcare. So we have to find new ways of doing this. And using data to be more preventive, to be wiser about who gets the right treatment at the right time is definitely a way forward. So We are focusing on long-term viability. So very clear action points in the strategy and the roadmap on short, middle, and long term. Very clear, how can we make this possible? So what are the challenges? Well, I think all of those challenges have already been mentioned, really, so I'm not going to go through it, but quite often I get the question, okay, so it sounds like it's a very broad scope of the initiative. And I reply, yes, it's very broad and it's huge, really transforming Swedish healthcare. How do you do that? Well, shouldn't you just prioritize? Where do you start? And really, you cannot just prioritize one of those areas because that is not going to be the system change, right? We have to make small steps forward in all of those different areas. That is how we reach the sustainability of the system. So data supply, thank you, Helena, very good. That is exactly what we need to do. We need to get the data. We can't even get the data out within the regions to ourselves for clinical decision making in the way that we would like to. Much less can we access the data as researchers. A very clear reality is that you ask for the data and perhaps a year later you as a researcher can receive the data. This is a reality, and this is what it's like in Sweden in many places. And we want to have access in real time, right, of the data. And that demands a digital infrastructure. It demands metadata, new structure, interoperability, and everything else with the data. And also a general or generic information model and standard. What is a patient visit? We need to have the same definition of a patient, of a visit, in every single system. Otherwise, we are going to compare apples and pears. So data supply is super important. The financial management and the reimbursement systems. Today, the healthcare pays the bills no matter the outcome of the patient. So we would like, or we would need, a value-based reimbursement system, right, in Sweden. That is how it would be sustainable. That is how we could actually finance really, really expensive advanced therapies, for instance. But we have to also make sure that the benefit comes to the patient, wherever that is, the value is in the societal chain, so to speak. So financial management is really important to also address in this initiative. And ethical issues, obviously. How do we choose what therapy, what diagnostics, what kind of care we provide to what patient and when? And regulatory compliance. We cannot share data, like Helena Linge just mentioned, between hospitals, between municipality and region, even though that we are providing care to the same individual. We have lots of those challenges when it comes to regulatory compliance that needs to be addressed. And I think, Anna, you talked about culture and processes and how we work as a system, and that is definitely something that we need to do on a national level and a local level, between different actors. We're talking about the quadruple helix. We all have our very important roles in this system. And how we are organized. What kind of competences do we need? We are not used to working with key competences such as data scientists in healthcare. But that is something that we need. We need data scientists. How can we compete with Spotify, with those big tech companies? That is something that we have to figure out for the future because we really need those competences. And obviously, we have to integrate research, innovation, development. It has to be completely integrated in this system. So what are we doing? This sounds huge. I know it's utopia, what I'm describing, and I can hear it myself. But at least it's the ambition of those healthcare directors. How are we going to do this? It's really system innovation, right? And how do you take that forward? It's always one small step ahead at a time. So we are working with our networks. Otherwise, this wouldn't be possible. We have cross-sector collaboration that is ongoing during this whole project. And it's really important that everyone is included and can participate from their role and their competences to this important work that we do together. It's really a team effort. I cannot stress that enough. And what we are doing at the moment is kind of a review of the current state of Swedish healthcare. So precision medicine in Swedish healthcare, what is the current state? And that is going to be done by Christmas. No, actually January. That's when it's going to be done. We will deliver that to the steering committee, and then we will together come up with, okay, so where do we want to be? What's the vision? And when we know where we are today, what is the vision, then we have to define the action points. How do we go from now to the future? And that will be the roadmap or the strategy. So we are just in the beginning of this work. It's hard work, but like Kamala Harris says, hard work is good work, right? So we do it with passion and joy, absolutely. So, right. Precision medicine centers. I mentioned that we are working in our networks. Rickard mentioned that there are genomic medicine centers in all the 7 university hospitals. There are also ATMP centers. There are also precision medicine centers. So we are trying now to form a network. It's only just started. We are trying. This is a bottom-up initiative. We want to come together to share experiences, knowledges, insights. How can we move this forward together? So, and I think we all feel that this is an important stage for us to move this. Actually, we can be very operative and strategic through this network as well. So with that said, thank you very much for your attention.